The life of Florence Nightingale and her contribution to modern nursing. Florence Nightingale, the founder of modern nursing, improved health conditions during the Crimean War, reducing mortality and setting standards that professionalized nursing. Florence Nightingale's life and contribution to modern nursing. Florence Nightingale, the founder of modern nursing, improved health conditions during the Crimean War, reducing mortality and setting standards that professionalized nursing. In addition, her approach to data collection and analysis pioneered the application of statistics to improve healthcare. In 1860, he founded the School of Nursing at St. Thomas's Hospital in London, which enabled the systematic training of nurses. His work, Notes on Nursing, remains an essential reference in the field. Her tireless dedication and humanitarian vision transformed nursing into a key discipline within modern medicine. Nightingale was also an innovator in hospital hygiene, emphasizing ventilation, cleanliness, and natural light in hospitals, which helped prevent infections. Her legacy went beyond nursing, as she also advocated for reforms in public health policy and healthcare administration throughout the UK, influencing the improvement of hospital systems worldwide. She was the first woman to be awarded the UK Order of Merit in 1907. During her lifetime, she wrote more than 150 works on health and nursing. Her influence extends to the present day, and she is considered a seminal figure in the professionalization of nursing. Join our adventure and subscribe to explore and learn about the past in an exciting way.